Hello iMovers, this is part 2 in the knee OA series. First video we spoke about self-identifying if you're in that pattern of pain. When you enter a pattern of pain, you're more likely to move and do less, which atrophies the muscles around your knee, which further contributes to weakness, which further contributes to the degeneration of the health in your knee. You get more pain, you do less, and it's an endless cycle. So that was step 1. Step 2 is, or part 2, when should you consider surgery? G'day Roman. The really interesting thing about surgery for knee complaints is it's not as strong as we thought or that you would think. A lot of evidence coming out now about knee cleanups, so arthroscopes they're called, or meniscectomies where they go in and just trim little bits of the irritated knee joint out. They've done studies where they've compared people getting that to a placebo study where they did an incision on the person's knee but didn't actually perform the surgery. And they found not much difference in outcomes. So should you consider surgery? Yes, it doesn't mean you rule it out completely. But what I would say to you off the back of yesterday's video is please do 8 to 12 to 24 weeks of solid physiotherapy, guided and graded strength work. Remember in part 1 we were talking about the GLAD study which came out of Denmark, and it showed at least a 30% improvement in symptoms and a huge jump in quality of life. So it doesn't mean you rule surgery out altogether. It just means you need to do 8 to 12 to 24 weeks of really good rehab before you consider that surgery. Thanks, legends. Stay tuned. Part 3, we're going to go about imaging for knees. So if you're interested in imaging and you've had a knee x-ray, stay tuned for that one.